Hello. In this video, we're going to focus on the EMT's essential skill of performing a comprehensive head-to-toe assessment for both medical and trauma patients. This video will guide you through the systematic approach required to efficiently and effectively evaluate a patient from head to toe, ensuring no injuries or medical conditions are overlooked. Whether you're encountering a patient with a medical complaint or assessing a victim of trauma, mastering this assessment is crucial for identifying life-threatening conditions and prioritizing care.
Remember to take the initial steps to ensure scene safety and proper use of standard precautions and personal protective equipment while also considering the need for additional resources. Then, after completing a primary assessment containing general impression, airway, breathing, circulation, and disability, it's time to get into the head-to-toe assessment to determine to help treat and assist your patient further. The thought process behind conducting a trauma head-to-toe assessment by an EMT involves a systematic, thorough, and focused approach to identifying all potential injuries a patient may have sustained. This method ensures no injuries are overlooked, especially those that may not be immediately visible or symptomatic. Starting at the patient's head, thoroughly assess the head, neck and spine, chest, abdomen, pelvis, limbs, and back for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. For the medical patient, an EMT conducts a head-to-toe assessment on a patient to identify both obvious and subtle clues that could indicate the nature of the patient's medical condition. This systematic approach allows the EMT to gather vital information that aids in pre-hospital treatment. During the secondary medical assessment, EMTs conduct a thorough examination to identify any other injuries or conditions that might have been overlooked in the urgency of the primary assessment. This allows them to create a comprehensive picture of the patient's health, uncovering subtle signs that could escalate into serious issues if untreated. By meticulously evaluating the patient from head to toe, EMTs can tailor their interventions more precisely, ensuring that every aspect of the patient's care is addressed. This phase is crucial for fine-tuning the treatment plan, emphasizing the commitment to immediate life-saving measures and the patient's overall recovery and well-being. It's a strategic, in-depth process that significantly enhances the quality and effectiveness of emergency medical care. Reassessing patients is a vital part of emergency care, serving as a dynamic tool for EMTs to track and respond to changes in a patient's condition over time. This continuous process ensures that initial treatments remain effective and allows for timely adjustments to care as needed. By identifying subtle shifts in health status, EMTs can intervene promptly, preventing complications and ensuring the best possible outcomes. It highlights the adaptable and responsive nature of emergency medical services, emphasizing ongoing vigilance and dedication to optimal patient care throughout the emergency response. Effective communication and timely transport are critical components of emergency medical services, ensuring a smooth handover from pre-hospital care to definitive treatment in a medical facility. Clear communication provides hospital staff with essential information about the patient's condition and treatments, allowing immediate and appropriate care upon arrival. Transport involves moving the patient and continuing care en route, adapting to any changes in the patient's condition. Together, these processes ensure that patients receive continuous, coordinated care, improving their chances for a positive outcome. These foundational skills ensure that every patient receives the highest level of care from the moment of first contact, guiding the critical decisions that can make the difference between life and death.
Click the link in the video's description to download EMS Pocket Prep and study any of our 7 EMS exam offerings. Pocket Prep is a mobile, quiz-based study platform designed to provide effective, engaging, and affordable study material for a wide range of certification and licensure exams. Download the app and get started studying for free today.